Okay, so restless leg syndrome is relatively new. I remember when restless leg syndrome didn't exist. It didn't exist. What exactly is it? It's this funny sensation in your legs that they want to move all the time. And, you know, the only way to get relief is to start moving around and sort of putting up your legs. It tends to get worse when you're fatigued. It tends to be worse at night. And sometimes it's worse if you exercise late at night. That's the kind of stuff that we look out for. So how do we treat it? Oh, it's a tough one. It's a tough one. Now, there's a bunch of medications. There's a new one called Requip that we use sometimes. I have to say that I get a little bit of restless leg syndrome myself sometimes. And it can be very difficult. Sometimes it wakes me at night and I can't get back to sleep. And my legs just feel antsy. They feel like you just want to get out there and do something, move it around a little bit. It's very, very annoying. Now, in Sarah's case, Sarah, you want to make sure that you have the correct diagnosis. The reason I asked about diabetes is you want to make sure that there isn't like a peripheral neuropathy, which means that the nerves in the legs are acting up a little bit. And we see that a lot in things like diabetes. But Sarah says she doesn't have that, so that's one good thing. And the next thing is you want to say to yourself, if I go on to one of these medications, which really affects the transmitters, the stuff in my brain, is it going to cause me more problems than not? So what I usually say to people in my practice is this. Think about this very carefully. How disruptive is this restless leg syndrome? Is it really bothering you that much? If it's not, try and live with it. If it is really bothering you, then we have to think about Requip and that kind of specialized medicine. Now, family doctors are prescribing these medicines all the time, so that's okay. We can do that. Guys like me do that. But sometimes what I would do in these circumstances is I would go and get a neurologist, somebody who's got an interest in that area, and say to them, let's go through what the other possible causes are. Let's see what else it could be. And then give me your best plan of how I can have some lifestyle changes. Maybe I can adjust this. Don't exercise before bedtime. Stuff like that that will help you as you move along. Those are the kind of ways that I approach it. In Sarah's case, you're a little bit older, Sarah. So I would be very conservative in managing this. Because what you don't want to do as you get a little bit older is start taking medicines that can affect how you're thinking, that can affect how you're functioning, or can make you just that little bit confused. You want to try and avoid those as much as possible. Anybody who's sort of older than 65, older than 70, you want to limit the number of medicines they're on, limit the type of medicines they're on, because the more you add in, and certain medicines are much more likely to do this than others, it just affects the quality of life. And that's what it's all about when we're talking here in Dr. Chambers on Call. We're trying to keep you healthy. We're trying to make you healthier. But we also want you to understand that if you're going to take medicines, how it's going to affect you, how it's going to affect your lifestyle, and how it's going to affect the quality of your life. And just because you have a problem doesn't necessarily mean that you have to start taking a pill. It doesn't mean that at all. So I want you to think about this. And Sarah, what I would do in your case is I would go back to the primary care doctor and make sure that you write down the questions before you go and say, maybe keep even a little diary, say, these nights it kept me awake. This night I slept well. This happened to me. Or I got the restless leg when I was sitting watching TV in the morning or whatever. Whatever it's going to be, keep a little diary for like a week with all of the symptoms. Then sit down with your doctor and say, look, this is really disrupting my life. Is it worthwhile going on specialized medicine for this, or is it not? And that's what I encourage most of you to do, no matter what your problem is. Because what you don't want to do is you don't want to jump into the pool and take a medicine. And in healthcare as it's run in 21st century America, it's run by big corporations, and they want their patients in and they want them out. They give 15 minutes per patient or less, and that includes all charting, all computer work, all everything. So you don't get a lot of time with your doctor. So what I like people to do is think before they go to the doctor. Maybe even write down the questions for stuff like this and say, oh, these are my concerns. And sometimes you get a little bit older, you might want to have somebody with you. Somebody's going to talk to the doctor on your behalf or ask the questions. Or sometimes in an emotionally charged situation, you're afraid you don't take in all the information. Bring somebody with you who will take it in. That's important.